Hello everyone, my name is Madeline Willis and I'm a student physical therapist assistant from Jeff State, and today we're going to be talking about congestive heart failure. So I chose this topic because it's really relatable to me and my family. My grandmother actually has in the early stages of congestive heart failure, and then my sister-in-law's father actually just passed away recently from congestive heart failure with a bunch of extra complications that come along with congestive heart failure. So I just thought it was really interesting and wanted to find out more about it and share it with you. So the first thing I'm going to talk about is just the pathology of congestive heart failure. What is it? What's going on with it? So this congestive heart failure occurs when the heart is unable to pump blood like it's supposed to. You can have congestive heart failure because you have another underlying disease. It could be because you have coronary artery disease or you have increased blood pressure. It could happen because the heart is becoming too stiff, or it could happen because the ventricles are becoming damaged and they're not able to stretch properly to fill with blood to be able to pump to the rest of your body. It can be left ventricle related, or right side or left side of the heart, or it could be right side of the heart, or it could be both. But most often it starts on the left side of the heart. And then it can move to the whole heart. Alright, so the different types of congestive heart failure, there's 4 different types. There's left-sided, like I mentioned earlier. This is when the fluid backs up into your lungs. It makes it really hard to breathe. Right-sided is when the fluid backs up into your abdominal cavity, your legs, your feet, all your lower extremities pretty much swell up. There's systolic. This is when the left ventricle cannot contract hard enough to push the blood out, so there's a pumping problem with the heart. Then there's diastolic, which the left ventricle cannot relax enough to fill up with blood to be able to pump, so there's a filling problem with the heart. Okay, so next we're going to talk about the signs and symptoms of congestive heart failure. So these can include shortness of breath when you're lying down or you're trying to exert yourself with physical exercise. You can be fatigued, have weakness, you'll have swelling in the lower extremities and the abdomen, as I was talking about with the right-sided congestive heart failure, rapid irregular heartbeat, you'll have a reduced ability to exercise, you may have a persistent cough, wheezing, like if you have the left side where it's filling up with your lungs, you can't really breathe that well, so it can make you cough, try to get that up, or even have like a wheezing in your breathing. You'll have increased urination at night, rapid weight gain because of fluid retention, lack of appetite and nausea, difficulty concentrating or decreased alertness. All right, so now I mentioned earlier that congestive heart failure can be due to underlying diseases. So here's some of the conditions and diseases that could cause or lead to congestive heart failure. So the first one is coronary artery disease, heart attack, hypertension, faulty heart valves, cardiomyopathy, myocarditis, congenital heart defects, or it can be from chronic diseases such as diabetes, HIV, hyper and hypothyroidism. So all of these can cause or lead to congestive heart failure. Okay, so now we're going to talk about the stages of congestive heart failure. There's 4 different stages and they're labeled A, B, C, D. So stage A is the pre-heart failure stage. You have increased risk because you have a family history of congestive heart failure, or you have one or more of the following. You have hypertension, diabetes, coronary artery disease, history of alcohol abuse, or rheumatic fever. All right, stage B is also still pre-heart failure, but you're actually diagnosed with systolic left ventricle dysfunction. But you don't have any of the symptoms of congestive heart failure. You just have that left systolic ventricle dysfunction. So usually these patients have an echocardiogram that shows an ejection fraction of 40% or less. All right, so stage C, this stage you're actually diagnosed with congestive heart failure and you have signs. So you have the shortness of breath, fatigue, weak legs, the inability to exercise properly, You have swollen extremities, swollen abdomen, you have the frequent urination, and again, you're unable to exercise, fatigue, weakness, all of that. So stage D is actually the final stage of congestive heart failure. You have very advanced symptoms. You don't get better with treatment usually. It's just kind of the end stage of it. And this is where my sister-in-law's father actually was when he passed away a month or two ago. All right, so next we're going to talk about statistics and population affected with congestive heart failure. Nearly 5 million Americans have congestive heart failure in the United States. Approximately 550,000 people are diagnosed every year with congestive heart failure. It can affect people of all ages. The most common age is 60 to 69. About 1.4 million who have congestive heart failure are under 60 years of age. So it's present in 2% of the people between 60 and 69, and more than 5% of people who are in that age group have congestive heart failure. It's equally frequent in men and women. There's not one that it happens to more. African Americans are actually 1.5 times more likely to have congestive heart failure than Caucasians. More than half of the people with congestive heart failure die within 5 years of being diagnosed just because it progresses so quickly. And it contributes to 287,000 deaths per year. So first I just want to talk about some medical interventions for congestive heart failure. Once you're diagnosed with congestive heart failure, it's pretty much a lifelong treatment. You have to be careful with what you eat. You have to manage those underlying diseases and conditions. Sometimes they can be corrected with treatment because you're correcting the underlying cause of the congestive heart failure. So sometimes it can be stopped because you're treating the underlying diseases if you catch it in the early stages. So just some medicines they usually give. They give ACE inhibitors, beta blockers, and diuretics. The diuretics is for all the fluid retention. It can help get the fluid off of them. Surgery and medical devices. If they have blockages that you can see, you'll do a coronary artery bypass. If they have a heart valve that needs to be repaired or replaced, they'll do that. Most of the time they implant a pacemaker. There's several different types of pacemakers, but they'll usually insert one in the heart, and then sometimes you have to have a heart transplant. So lastly, I'm talking about where we come in with physical therapy. Most of the time these patients go to cardiac rehab. This can last, it's usually 12 months, and it has 3 different phases. So you want to do aerobic exercise and even resistance training with these patients. So like the treadmill, recumbent bike, elliptical, the new step, and use resistance bands with when you're doing resistance training. You want to progress the exercises as they can tolerate, but you also want to give them rest intervals to be able to catch their breath, because with the shortness of breath, a lot of them, their oxygen will drop really low. So you have to give them those rest periods. With the cardiac rehab, you usually start with a 5-minute warm-up, then you'll do your aerobic exercises for 20 to 30 minutes. You'll have a 5-minute cool-down period, and then you'll do some strength training. But during all of this, you want to make sure that you are monitoring their heart rate and O2 and documenting that throughout the session. Some other education perspective of PT. You want to educate them on energy conservation, taking rest breaks when they're having to walk long distances. They may need a walker, and they may need a chair halfway through their house, wherever they need to stop. And you want to educate them on weight management too, because the fluid is going to add weight already to them. So you need to make sure they're getting a good, nutritious, balanced diet, and that they're watching their weight. You want to teach them breathing techniques, and you want to train them on the fitness equipment at the PT gym, so that way after they're through with cardiac rehab in the PT setting, they can continue it at their gym. The physical therapy main goal for these patients is to stabilize, slow, or even kind of reverse the progression of congestive heart failure. it all depends on the patient. I know we're tired of hearing that word, but it really does depend. They have to be willing to put in the work. And if you've caught it early enough, you really can slow the progression, and they're on the right medicine, they're exercising properly, you really can kind of slow that progression. Here's my references. If you guys have any questions for me, just drop it in the discussion and I'll answer it as soon as I can. Thank you so much for watching.